For millions, debilitating knee pain makes surgery feel like the only option left. But what if there was a way to potentially delay or even prevent knee replacement surgery? This isn't just a temporary fix. Studies show 2/3 of patients needed no other treatment for 4 years. This is the promise of stem cell therapy, using your body's own healing power to fight knee pain. Domestically, stem cell therapy is less expensive than knee surgery, but it's still pricey and rarely covered by insurance. However, in international destinations like South Korea, costs are 30 to 60% less than comparable treatments in Western countries. The country's reputation for medical excellence, combined with its advanced research in stem cell therapy, makes it an attractive destination for patients. This means minimal recovery time compared to the months required after a knee replacement. The goal isn't just pain relief, but the potential to naturally regenerate damaged tissue in the knee joint. And the improvements aren't fleeting. Studies confirm significant pain relief and function are maintained at 12 and even 24 months. The results are compelling, but it raises a critical question. How is this biological repair actually happening inside your knee? What do these stem cells actually do once they're injected? It's not magic, it's a targeted biological process. First, these master cells are introduced to the damaged area. They have the unique ability to transform into the specific cells your knee needs, but they don't just rebuild. They release powerful growth factors, signaling your body's own repair systems to get to work. Finally, they have a potent anti-inflammatory effect. This is key because chronic inflammation is a major source of pain and damage. So that's how they work. They rebuild, they signal, and they soothe. It's a multi-pronged attack on joint damage and pain. Understanding the science is one thing, but what does this mean for a patient? Let's look at the real-world procedure. The procedure itself is typically straightforward. It's done with local anesthesia, meaning little discomfort and often no downtime. How does it compare to steroids? A Duke study found stem cells offered the same benefit, but with added tissue regeneration potential. But here's where the science gets truly fascinating. A Mayo Clinic study revealed something unexpected: a systemic effect. They found that injecting stem cells into one knee led to pain relief in both knees. It's a whole-body healing effect. A regenerative, systemic treatment sounds almost too good to be true. So, let's get realistic and talk about the downsides. First, what are the risks? They are considered minimal, usually limited to temporary pain or swelling at the injection site. In fact, a major review found no risk of serious complications like sepsis, embolism, or death from this procedure for knee pain. The next question is cost, as it's often not covered by insurance. Typically, treatment ranges from $5,000 to $8,000. Finally, this is still an evolving field. While current data is strong, long-term research on efficacy and safety is still ongoing. So we have high success rates, a clear mechanism, but also costs and ongoing research. How do we pull these threads together? Remember our opening question about avoiding surgery. You're trading the high risks of major surgery for the minimal risks of an injection. And the biological mechanism, that three-part process, is what drives the long-term results. It's true repair, not a band-aid. When you place it next to other conservative options, the evidence is compelling. One analysis called it superior for knee osteoarthritis. So we come back to the main question. Is stem cell therapy the answer for your knee pain? The evidence shows it is a powerful potential solution. It represents a shift from managing symptoms to actively promoting healing. The argument rests on 3 pillars: high success rates, a regenerative mechanism, and a vastly better safety profile than surgery. The decision is personal, weighing the significant potential against the cost and the current state of research. It's a major advancement. The ultimate answer lies in a conversation with a qualified doctor. Use this information to ask smarter questions about your options.